Once you and your doctor decide CAR T-cell therapy at MD Anderson Cancer Center is the best treatment for you, the financial team will obtain financial clearance from your insurance company, and then the care team will collect your cells. The cell collection process is known as apheresis. If you receive CAR T-cells from a donor or cord blood, you won't need apheresis. If you need apheresis, it is important that you do not have any cancer treatment for at least 2 weeks prior to and no steroids within 7 days of apheresis. Prior to the apheresis procedure, you will have an appointment in the Stem Cell Transplant Center where a doctor will evaluate you, including an assessment of the veins in your arms to decide if you need a special catheter placed to collect the cells. Most patients need the catheter, and if you do, the care team will place it on the morning of your apheresis procedure. The cells are collected in the apheresis unit, and the procedure usually takes about 3 to 4 hours. If you have a catheter for the procedure, the care team usually removes it the same day after the procedure is complete. Sometimes, the care team may need to repeat the cell collection procedure the next day. If that happens, the catheter is left in place overnight. The care team will provide you with more information about the procedure and ask you to sign a consent form. A family member or friend may stay with you during the procedure. After the care team collects your T cells, the cells are sent to a special lab which alters them so that the T cells can recognize cancer cells. The time it takes to alter the T cells can vary depending on the cell product. Your cell coordinator or research team will discuss the timeline with you. During this time, you may need treatment for your cancer. This is known as bridging therapy and may include chemotherapy, immunotherapy, radiation, or steroids. Your doctor will let you know if you need bridging therapy. If you do, it is normally completed at least 2 weeks before starting the CAR T-cell process, but it depends on the type of therapy used for bridging. Your doctor will talk with you about the plan for bridging therapy if needed. When the altered CAR T-cells arrive at MD Anderson, the cell coordinator or research team will contact you, and you'll have an appointment with your doctor to decide if you're ready to start the CAR T-cell process. Before you start the CAR T-cell process, you'll have a CAT scan of the brain if you have not had a recent one. The CAT scan provides your care team with a baseline image of the brain in case you develop neurological side effects after you receive the CAR T-cells. You may also need a PET scan or other tests. If so, your cell coordinator or research team will let you know which tests you need. Your care team will insert a PICC line into an arm vein if you do not have a central line, port, or PICC already in place. They will use the PICC line to give you the CAR T-cells, fluids, medicines, and blood products, and may also use it to draw blood for labs. Sometime before the cell infusion, you may receive an IV infusion of medicine called pentamidine to prevent a certain type of pneumonia called pneumocystis. Some patients can receive the CAR T-cells as an outpatient. Others require admission to the hospital to receive the cells. Your doctor will assess your specific situation and decide the best location for you to receive the cells. Talk with your care team if you have any questions.